Thank you, Mr. Chair. Mr. Chair, a few rounds ago, there was a back and forth between Senator Daines and Secretary Kennedy about Mifepristone. So Mifepristone's safety profile is well established, 25 years of data, 100 peer-reviewed studies. It's a safety profile that is better established than many everyday medications. And so I'd like to submit for the record, Mr. Chair, 40 peer-reviewed statistically significant studies on Mifepristone's safety profile. These are the same that Senator Hassan submitted during Secretary Kennedy's confirmation hearings.
Mr. Chairman, just very quickly, I'd like to associate myself with your important remarks.
Without objection.
Thank you very much. Good morning, Mr. Kennedy. I'd like to talk about prevention and where we should be able to agree not only to how prevention can help to keep Americans healthier, but also save healthcare dollars. And I'd like to start by associating myself with Senator Barrasso's questions and concerns about what's happening with the Preventative Services Task Force. But let's get into it. Last week you said that screening for prevention is absolutely critical. So I want to dig into that. I agree with that. Let's start with mammograms. Would you agree that mammograms are important preventative healthcare?
Yes.
Absolutely. I agree with that too. So it makes me wonder why your agency cut the programs that fund breast cancer screenings. Hospitals in my neighboring states of South Dakota and North Dakota actually had to pause breast cancer screenings because your agency announced cuts to the National Breast and Cervical Cancer Early Detection Programs. Doesn't make any sense to me. Let's try another one. Is depression screening preventative care in your mind?
And depression?
Yes.
Yes.
Yes, okay, I agree with that too. However, the Trump administration and congressional Republicans pushed through the biggest cuts to Medicaid in the history of that program, and Medicaid is the largest payer of behavioral health care. So that's cutting access to care for millions of Americans to get mental health care. How about smoking? Is smoking cessation, preventative care?
Yes.
Okay, so again, your latest budget eliminates the CDC's Office for Smoking on Smoking and Health, and 200 CDC employees who were working on smoking cessation are gone now. The flu shot, is the flu shot preventative care?
Yes.
Okay, so you said that it would be better if fewer kids got the flu shot. You've rescinded recommendations for scientifically and medically sound flu vaccines. You've canceled public awareness campaigns about the importance of getting the flu vaccine. I mean, this is not a record that matches with saying that preventative care is important. I do not understand the contrast here between what you say you want to do and what is actually happening in this administration. Now, let me go to this. Are you familiar with Title X?
Yes.
Okay, great. Title X is a highly successful, comprehensive strategy to provide birth control and preventative care to low-income women. And we know that every dollar that's invested in Title X, Mr. Chair, saves somewhere between $3 and $7 in Medicaid costs, preventing unintended pregnancies. So, Secretary Kennedy, can you explain why you are recommending zeroing out funding for Title X, which would eliminate screenings for cervical cancer and would almost certainly result in higher unintended pregnancies?
Can I respond to some of your earlier statements?
Please.
First of all, there are no cuts in Medicaid. I keep saying this. Here's what the CBO said. Fiscal year 2025, $668 billion. Fiscal year 2036, $981 billion. That's not
Secretary
a cut.
Kennedy,
it's a 47%
$1 trillion
increase.
in cuts, according to the CBO. 7 million people losing their health insurance because of the Trump administration actions. That's not debatable.
There's nobody who is legally enrolled in Medicaid who is losing coverage.
That is just not true.
Nobody.
That is just not true.
It is so.
How else would you like to respond to my questions about why the administration is cutting preventative care?
We're putting, a lot of it is being returned to the states. We're doing a $667 billion block grant to the states for
My
mental health.
counties
and
are
addictive
asking
services.
why the cost shift to their taxpayers is happening at the same
It's the
time that
federal
rural
taxpayer. The
hospitals are
states
going
admit it.
out of business,
The
Secretary
states administer
Kennedy.
the programs better than we do. So we're giving the same money to the states to administer the program.
That is not the way it is working. Thank you, Mr. Chair.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.